Hello friends, today we will discuss about the action potential in the cardiac muscle. Okay, so what is this action potential and about resting movement potential? We have already made a detailed video. Those who have not seen that, we request them to please go to the playlist of the channel Doctor's Corner. In that we have discussed about the resting movement potential, a separate video, and in action potential in English as well as in Hindi. Okay, so let us discuss about this topic today, just to have an introduction about what is resting movement potential and action potential before going in detail about this topic. So consider this as an cardiac muscle cell. Okay, consider this as the cardiac muscle cell. Okay, a cell, the interior is called as the fluid inside it is known as intracellular fluid, and outside is known as ECF, that is extracellular fluid. So in the ECF there will be so many ion channels, okay, positive as well as negative ion channels. Okay, similarly outside is also having positive as well as negative ion channels. Okay, but ultimately if you sum up all these ion channels, okay, the interior is negative as compared to the exterior, and that is simply known as resting membrane potential. So the resting membrane potential is the potential difference across the cell membrane at the resting condition of the cell. So normally it is around minus 90 millivolt in case of cardiac muscles. Okay, it ranges from minus 85 millivolt to minus 95 millivolt, but we can take an average, it is around minus 90 millivolt. Okay, so how does we record the resting membrane potential? We record with an instrument known as cathode rays oscilloscope. Okay, basically it's a voltmeter which sense the change in the potential difference across the cell membrane. Okay, now suppose if we keep both the electrodes on the cell membrane and connect it to a potential difference recording device, it is a voltmeter, and more specifically here we use an instrument known as cathode ray oscilloscope. Okay, now if we keep both the electrodes on the cell membrane, the deflection will be zero. Okay, that is, there is no net difference on the cell membrane, though there are certain positive and negative charges inside and outside the cell, but the overall deflection what we see is negative, zero. Okay, there is no deflection. But if we put one electrode inside the cell, okay, if we put one electrode inside this cell, and one on the surface of the cell, now this recording device, it will record some deflection and it will be negative, that is minus 90 millivolt. It is negative inside with respect to outside. It is number of the negative charges are more. How much more? Up to minus 90 millivolt. That potential difference across the cell membrane, the resting condition, is simply known as resting membrane potential. Hope it is clear. Details why genesis, why it is negative and all we have discussed. One of the factor is sodium potassium pump, though there are so many other important factors. One of the contribution, but that too small contribution, is by the sodium potassium pump. Okay, now resting membrane potential we have discussed. Then uh, action potential. Now suppose on this same cell, if we use some stimulus, that is with the help of a battery and all, some electrical stimulus to this cell. Okay, some electrical stimulus we give to the cell. Now due to this electrical stimulus, many of the ion channels which are present on this cell membrane, like sodium, calcium, potassium, they get opened up, and few ions will move from outside to inside and few ions from the inside to outside, and there is a deflection in the net charge. That deflection in the potential difference when the cell is stimulated is simply termed as action potential. Hope the concept is clear. What is resting membrane potential and what is action potential? Now if it is clear, now we will come to our main topic, action potential in the cardiac muscle. We learn the action potential curve and what is the causes and the ionic basis. Okay, please give your kind concentration. Okay, because we are discussing some molecular level. Now consider this as again a myocardial cell, a cell membrane, and outside is extracellular fluid, inside is intracellular fluid, right? Now we'll learn the action potential with the help of one graph known as action potential curve. Okay, so on x-axis we'll plot the time duration in millisecond. Okay, we'll plot it as 0, 50, 100, 150, 200, 250 and 300. Okay, this is the time duration. And on y-axis we'll record the potential difference in millivolt. Okay, so initially it will be like minus 90 millivolt, minus 80, minus 70. okay, minus 60, so and so, then it will be 0, plus 10, plus 20, okay, so and so. So on y axis, that is the potential difference in millivolt and this one. So as we have already discussed, at the resting condition, if we record with the help of this cathode rays oscilloscope, one electrode out on the cell membrane, one inside, so the potential difference in the cell membrane will be around minus 90 millivolt. Okay, you will get a straight line. Resting condition, the potential difference shown by that cathode rays oscilloscope is 90 degree. But when the cell is stimulated, a myocardial cell is stimulated, there are certain changes. Let us discuss what are that changes. So when this cell is electrically stimulated, for example, there is opening of certain channels. Okay, mainly the sodium channels will first open. These are not the voltage gated main channels, but due to the stimulus, some nearby either cation channels, either calcium also or sodium also, but mainly sodium. So the sodium from outside will enter inside the cell. So once this sodium enters inside the cell, already inside it was minus 90 millivolt. Because of the more entry of the positive charge, this minus 90 millivolt will tend to become towards positive, that is it will become minus 80, minus 85, minus 70. So this potential, when due to the opening of the cationic channels like sodium channels, it will tend to become minus 80 and up to minus 70. When it reaches up to minus 70, so this level of minus 70, it is called as threshold potential. Okay, threshold potential. So what is the threshold potential? Threshold potential is the minimum potential at which action potential can be generated. Suppose if the strength of the stimulus is less than the threshold potential, it is called as sub threshold potential, and it will not lead to the generation of action potential or any electrical activity in the cell. Thus there will be a small local potentials. Okay, so when it reaches up minus 70 millivolt, then there is opening of the voltage gated sodium channels. Main thing, remember, voltage gated, they are sensitive to the voltage, that's why they are termed as voltage gated. So when it reaches to minus 70 millivolt, then only it will open, and there is entry of the sodium channels from outside to inside. The sodium channels will enter fast. Okay, more amount of the sodium channels will enter inside the cell. Why? Means because outside extracellular fluid there is more ECF and less in the ICF. So more amount of the sodium channels will enter, and the potential inside that will grossly, it will be tending to become positive, that is minus 70 to minus 60, minus 50, up to 0, up to plus 10, and up to plus 20. Okay, grossly it will tend to become positive. Now this phase, it is known as depolarization. Okay, let me write here to have a clear concept. I'll write the phases here. First phase, okay, then what is the name of that phase also will write, and what is the ionic basis, okay, name of the phase. So first phase is termed as zero phase. We'll just write the zero phase, and the name of that phase is depolarization. Okay, that is known as depolarization. What is the ionic basis? It is due to opening. I will write O for opening of the voltage gated sodium channels. Okay, so this is the zero phase or the first phase. You know, at the resting condition, the cell is said to be in a polarized state. So when from the polarized state of minus 90 millivolt, it will become positive, it is called as depolarized. Okay, and when again it will coming back, it is called as repolarization. Okay, so basically how this sodium channels will open and closes, I'll just show a sodium channels. What is the main mechanism is, suppose these are the sodium channels. Okay, these are the sodium channels. So at the resting condition, they will be closed. There are voltage gated sodium channels. So the gated means there will be some gate, activation inactivation gate, it will be closed like this. So sodium entry inside the cell is stopped. But once it reaches to minus 70 millivolt, once it reaches to minus 70 millivolt, this voltage gated sodium channel, this is called as activation gate, this is called as inactivation gate, they will tend to open it. Okay, bit like this. Okay, bit like this, they will tend to open it, and the sodium ions will enter inside the cell, and sodium ions from outside will enter inside the cells because of the opening of this gated channels. Okay, and once it reaches a certain level, for example plus 10 or plus 20 millivolt, what happens is this sodium channels again it will become inactivated, and finally it will close like this. Okay. So initially resting membrane potential it was like that. During the activation phase it will open, and after some time there is closure of the sodium channels, and during the resting membrane potential again it will come back to its initial phase like this. Okay. So now at about plus 20 millivolt it will close. Now due to the closure of that, again there is opening of the potassium channels. So once these sodium channels are closed, the interior has become more positive. Earlier it was minus 90, now it has become how much? Plus 20 millivolt. So there is more positive channels, positive ions inside as compared to outside. Now what happens is, after that the potassium channels also opens, and the concentration of the potassium is more inside the cell as compared to outside the cell, and also the positive charges are more inside the cell. So because of the electrical gradient as well as the concentration gradient, the potassium will tend to move out. So potassium channels from inside will tend to move outside. Now when the positive charge is moving outside, so there is a loss of positivity or the positive charges from that, so the membrane will again tend to become negative. So plus 20, from that plus 20 it will try to become it will now become plus 10, plus 5, it will try to come up to 0 or towards this negative, and this phase, this is known as first phase. Okay. And the earlier was phase 0. So this phase is known as phase 1, it is known as initial repolarization or simply initial rapid repolarization phase. So what happens is, due to this initial rapid polarization phase, there is opening of what? Potassium channels. Okay. And also there is closure of sodium channels. So sodium channels closes and the potassium channels will open. This is known as phase 1, and already we have discussed the phase 0. Phase 0 was depolarization phase. It was due to opening of the voltage gated sodium channels. Now phase 1 is again due to opening of the potassium channels. Now it was trying to bring the negativity inside because the positive charges were moving outside. Now immediately after that, what will happen is, most important thing is, in the cardiac muscle there is opening of the L type calcium channels, very important, slow channels, calcium channels, and from this slowly calcium will try to enter inside the cell from outside. So and this calcium will be open for a longer duration, for around 200 milliseconds, 150 to 200 milliseconds. So this phase, it is known as phase 2 or the plateau phase. Okay. So after that there will be phase 2, this is known as plateau phase. Again it is due to the opening of the calcium channels. Okay. And also there are potassium efflux, that is the potassium efflux which was going on, it will be open, but that there is a decreased efflux when there is an increase in the calcium and there is exit of the potassium, but though potassium is decreased, so there is no much net change and the membrane will be in the constant level. That's why it is known as plateau phase. This is known as second phase or the plateau phase. Okay. After that, after this it will take for a longer duration, and plateau is very important because of this will convert, it will provide the calcium for the mechanical events. Okay. We will discuss that excitation, contraction, coupling also in the another video. Right now we are concentrating only on the action potential of the cardiac muscle cell. Now after that, once again there is a phase 3, that is when the calcium channels ultimately after a long period of 150 to 200 millisecond it will closes. So entry of the calcium is closed, and again the potassium channels will open fast and the potassium exit will be more, and more amount of the potassium is moved out, and it will bring the membrane potential to negativity, that is positive charges is going outside. So it will bring it up to the resting membrane potential, and this is known as phase 3. So the phase 3 is again a repolarization phase. Repolarization phase, again it is due to the opening of the potassium channels and the closure of the calcium channels. So calcium channels will close and there is opening of the potassium channel, that is the phase 3. Then finally when it touches the minus 90 millivolt, there is a phase 4 of resting membrane potential. Phase 4 of resting membrane potential, it is again due to the closure of the potassium channels which was open. Okay, so these are the 5 phases: phase 0, phase 1, phase 2, phase 3, phase 4. Okay, let us revise once again what we have studied today: the action potential curve in a cardiac muscle. Okay, in a cardiac muscle cell or the myocardial cell. So at the resting condition it was minus 90 millivolt. There is opening of the sodium gated channels and it will become positive, that is phase 0. Then it is again phase 1, it is due to the opening of the potassium channels and closure of the sodium channels. Then there is a phase 2 or plateau phase, it is due to the opening of the calcium channels and decrease exit of the potassium channels. Then afterwards sodium channels calcium channels are closes and potassium channels opens rapidly and there is a rapid repolarization, and after that there is a plateau, that is the resting membrane potential. So we have phase 0, 1, 2, 3, 4, and you have to remember the cause or the ionic composition. So hope we have discussed this. So the difference is it has a long, this action potential is around 250 to 300 milliseconds. Okay, the total duration extends up to 250 to 300 milliseconds. This, whereas it is very much short in case of skeletal muscles and the nerves. So they have two phases only: depolarization and repolarization. Here there are so many phases: phase 0, 1, 2, 3, depolarization, initial rapid repolarization, plateau phase, repolarization, and resting membrane potential. Okay, so we'll finish this thing, this particular thing, and we will continue the other topics of the cardiovascular system in the next videos, like origin and conduction of the cardiac impulse and the properties of the cardiac muscle. So please subscribe our channel and share the link with your friends for this type of amazing videos. Thank you.